Welcome to the course Dietary Principles and Management of Obesity. Today we are going to discuss about the topic 1 obesity classification. Myself Dr. G. Sirisha. This lecture covers what is obesity and also prevalence of obesity, classification of obesity. So what is obesity? It's a condition characterized by the excessive accumulation of body fat, so which can have significant negative impact on an individual's overall health and well-being. It is the result of a combination of genetic, environmental, and behavioral factors, including poor diet, lack of physical activity, and underlying medical conditions. Obesity increases the risk of developing a range of serious health problems like heart disease, type 2 diabetes, certain types of cancers, and even premature death also occurs. Prevalence of obesity. When we look into the global trends, according to the WHO, the prevalence of obesity has nearly tripled since 1975, with over 650 million adults classified as obese in 2016. Regional disparities is also there. The burden of obesity is not evenly distributed across the globe, with some regions and countries expressing much higher rates than others. For instance, US has one of the highest obesity rates, nearly 40% of adults as obese. In certain parts of Asia and Africa have significantly lower obesity prevalence. Demographic factors also influences the obesity, as like age, gender, and socio-economic backgrounds, but certain demographic groups are disproportionately impacted. For example, obesity rates tend to be higher among older adults, certain racial, ethnic minorities, and those with lower socioeconomic status. Classification of obesity. Based on the BMI, the obesity are classified. So, who are having BMI 30 or higher, indicating obesity? It provides a standardized way to assess an individual's weight status relative to their height. And another technique used for the assessing obesity is waist circumference is another important measure of obesity, as it specifically evaluates the accumulation of abdominal fat, which is particularly hazardous to health. Another method is body fat percentage. While less commonly used, body fat percentage can also be a useful tool in classifying obesity, as it directly measures the amount of fat tissue in the body. So obesity classes is like this. Three main categories are there. Class 1 BMI of 30 to 34.9, class 2 BMI of 35 to 39.9, and class 3 BMI of 40 or higher, each with increasing level of health risk. So, body mass index calculated by dividing an individual's weight in kilograms by their height in meters squared. So, this simple formula provides a standardized way to assess a person's weight status. How to interpret this BMI is below 18.5 is considered as underweight, 18.5 to 24.9 is considered healthy weight, 25 to 29.9 is considered overweight, and 30 or above is considered obese. So limitations in this BMI is a thing. What is that limitations? As it does not distinguish between muscle and fat mass. In certain cases, such as with highly muscular individuals, BMI may not accurately reflect their true body composition. This is the limitations of the BMI. So, go through this, try to answer this. can you check the answers with this slide? Is it correct? Explain why BMI is not the only indicator for assessing obesity. Provide at least two reasons and support your answer with examples or evidence. So BMI is not the only indicator for assessing obesity because does not take into account factors such as muscle mass, bone density and overall body composition. Additionally, BMI may not accurately reflect an individual's health status or risk of chronic disease as it does not differentiate between fat mass and lean body mass is the main limitation. So waist circumference is one of the measurement using for assessing the obesity. So by wrapping a tape measure around the waist at the level of the hip bone, ensuring that tape is snug but not too tight. So significance of this waist circumference is useful indicator of abdominal fat, which is closely linked to the development of metabolic disorders and cardiovascular diseases. It means some people their abdominal fat is more than their weight. So they are in the normal weight but abdominal fat depositions is there. Based on this waist circumference technique, we may assess this risk. What is the risk thresholds? A waist circumference greater than 40 inches for men and 35 inches for women is associated with an increased risk of obesity related health problems. Other measures of obesity is skin fold thicknesses. So skin fold measurements also one of the measurement for assessing the subcutaneous fat stores. And also bioelectrical impedance method uses a small electrical current to estimate the proportion of fat, muscle and water in the body. And dual E energy X-ray absorptiometry is one of the technique to measure the density and distribution of bone, muscle and fat in the body composition. And magnetic resonance imaging is also one of the method. Dimensional images of the body's internal structures including the distribution of fat, muscle and organs for a comprehensive assessment of the obesity. So what are the health consequences mainly from this obesity is cardiovascular diseases, type 2 diabetes, certain cancers, musculoskeletal disorders and etc. So let us summarize. Obesity is one of the main medical condition characterized by the excessive accumulation of body fat which can significant negative impact on individuals overall health and well-being. So obesity classification mainly done based on the BMI, waist circumference and also body fat percentage. Thank you.